Mentor is going to lead us off, and so once we go live, or all up there, and we've got a bunch of budget. Oh, there it is.
Now we're gonna find out about Gopher.
We're going to.
Oh, you already, the secret sauce.
And Chris Cole is back with us.
You let that cat out of the bag, Wes.
We heard about Gopher already.
You did?
All right.
What am I missing?
Good morning, thanks for inviting us in.
This, the name of the, ride.
Oh.
It's not
Oh, yeah,
Go
Gopher.
For.
Yeah, Gopher.
Let's go for it.
Gopher.
It's
It's Vermontese for Go For.
I just asked her
Gopher.
how many people she had working, and I thought that 2025, she's 176 people working.
So I am the executive director of Capstone Community Action. And just to give you some background, which is really what I'm here to do, Capstone is an anti-poverty organization, been around since 1965, originated from the War on Poverty. And we are one of 5 community action agencies around the state. And we do a lot of different things, focused first and foremost on helping address people who may be in crisis, whether it's food insecurity, housing challenges, heat. We provide the crisis fuel assistance, but we also have a variety of programs to help really build Louders out of poverty, and that's where the program we're talking about today arises. We have workforce development programs. We help people start businesses, micro business development. We help people with their personal finances. We help them with their taxes. And when I started this job just over 4 years ago, we did a community needs assessment and a strategic planning process. And I learned that one of the biggest, in fact, just behind housing, the biggest barrier to helping people out of poverty is transportation. And as you all know, I've spent most of my career in the world of transportation for the state. And it was a hard thing to really ignore when people said without access to transportation, people are literally trapped in poverty. And it's a much greater and graver problem than I certainly ever understood. So this program has really evolved out of that. And you all have supported an earlier initiative, one of the first efforts when we came here thinking about transportation, the Mileage Smart program, where you helped us subsidize the low-income folks to get fuel-efficient used cars. So that program is well underway, and I think the state is really considering it one of their programs now. We are proud to be a part of that. So that helps people, you know, middle-income, low-income people be able to afford used cars that are more fuel-efficient and electric predominantly. But what this effort is about helping people who will never be able to afford a car. And the state has really partnered with us on thinking about how do we build out our public transportation system, but think about new strategies. We did, through the grants that you all helped provide, the MTI grants, we've done transportation planning around this. I did share with you some data that we had from a very comprehensive survey that showed 35% of the folks we surveyed, or that the consultants surveyed, 35% have unmet transportation needs.
That's statewide.
This is in the region that Capstone serves. So Capstone serves in the central Vermont, so-called.
Oh.
Lamoille County, Washington County, and Orange County. That is our territory.
Oh, you don't cover Burlington or
No, we do not.
CBOEO.
Yeah, CVOEO is our sister organization, and they're Franklin, Grand Isle, Chittenden, and Addison. That's their region. And then you have Bennington and Rutland, Rock. You have NECA in the Northeast Kingdom, and SEVCA, Southeastern Vermont Community Action. Those are the 5 different community action agencies. And we do get federal money, and that's who does the weatherization program. I know Senator Kitchell knows all of the work that we do and is a big helper of our work. And
she's still burning coal, so we're trying to help her use up that coal.
Literally.
so after we had this strategic plan and this focus on transportation and how do we address the needs of people who really will not afford to own a car? And how do we build off the existing public transit system, which you all have been supporting for many years? And how do we use technology? And how do we think also about our climate and the transition to electric vehicles? So we are starting a new program, and I will say that Capstone is incubating this and really launching a new nonprofit called Community Rides Vermont. Now, I know there's some concern about another new nonprofit. I understand that. I will say Capstone has a long history. We were the incubator of the food bank, which is now a really substantially important program and across the state. We incubated Down Street. It used to be a program of community action, then it became what is now known as Down Street.
How do you compete with, like, you got the food shelf, and you do food also, so there's two?
Well, the food bank is really a distribution service. They get food and distribute it to over 200 food shelves. We are a food shelf that
Oh, I
partners.
see.
We
Okay.
get food. We have to pay for that food.
They're out of Barry, right?
Their main,
Because I know we have one in Colchester, they
They
order
supply the
food,
local banks.
and sometimes they call them either short mayonnaise or something, and then,
Right.
sell them 4 or 5 cases of mayonnaise, but, so that's the way it works.
yeah,
So you can't go there to get food, they distribute it to the food
that's
center.
right.
Oh,
And they are a distribution system for us. They also partner on a workforce development program called Community Kitchen Academy, I was telling you about. So we partner in a lot, we're doing new programs with them to try to be what's called a mobile food pantry. During COVID, we realized how many people couldn't get to our food shelves. So now we actually go out to folks who are isolated and unable to come to us, different things. So they partner with us, but primarily they distribute the food and we're the place where people come.
Is that where someone gave $1 million or some?
Oh, the food bank.
That's not to us, that's the
No,
food bank.
but I'm with the.
Yes, 9 million.
Yeah.
Yeah.
Mackenzie Scott.
Bezos, former
Yeah,
spouse.
Vermont got a-
We're trying to get some of that money for us, but we don't have any yet.
Well, they must go through all the food then, because if there's supplying the whole
It's
state.
extreme
Wow,
and it's really increased substantially.
wow.
We do pay for the food we get from them.
Oh, okay.
And we also get gleaned food. We get food donated from the folks who go out to the farms and the food that hasn't been harvested, they come. So we actually get a substantial amount
That's
of
from
food from.
Salvation Farms, and they want
Yeah,
a million.
Yeah, the one in Central Vermont is called Community Harvest of Central Vermont. So this program is really about starting a new initiative to use all electric vehicles to provide essential rides to Vermonters. So we are getting started literally this month, and the program eventually will be called Gopher. As it is started in this first phase, what we will be doing is having a small fleet of cars, 4, to begin providing services for the elderly and disabled and Medicaid transportation, as well as the substance recovery program. I forget the
This
name of
would
it.
be a variation on the volunteer drivers, so you would actually provide some base of available drivers.
Right, and one of the challenges is that the volunteers, there's been it's really delayed. So, but if you look at the back, so that's how we start. But we're really looking to grade a variety of systems. So we also know that businesses can't get folks to their work. We've been in touch with, for example, the Medical Center of Central Vermont. The Central Vermont Hospital told us, and this is pre-COVID, that they had 200 unfilled positions, Senator, just like we were talking about. And when they surveyed those people, the major reason they can't take the job is because they don't have transportation. That's just in the Central Vermont Hospital, and particularly for entry-level jobs, which is the stuff they need more than everything else. Darn tough, it's got its branch in Northfield, now it's opening up in Waterbury. We have people in Barry who want to work, but can't consistently get to the jobs. So we're trying to fill that gap. We've worked closely with our economic development folks. We are in the so-called CEDS, the what is it called? Comprehensive Economic Development Strategy for Central Vermont. We're like the third priority on that list because we see this as a workforce development program as well. We also see it eventually as for the private sector, for individuals who are used to being able to go somewhere and push a button and get the ride hailing service, Uber or Lyft. We're trying to become available at that scale for Vermonters who, for example, may want to only own one car if they could depend on a reliable system. So we're starting with a contract. We are a subrecipient to Green Mountain Transit to provide those rides, Senator, that the volunteer driver pool used to do, and now they are having a harder and harder time with. But we're going to build on that. And we believe that we have more opportunities to get different kinds of payments, whether it's from employers who really want to get those folks to work, whether it's the medical system who need to get people to the doctor's visits in the hospital, or whether it's the individual who just wants to be able to get a taxi ride.
We have taxi services in there.
We have
Yeah.
some and very few.
Yeah, not many, I think there's one left in Burlington. one or
That
two.
way, used to
No,
be
they're
that.
gone, yeah, they're gone. There's one in Essex Junction, a small one.
It's
there.
not like a fleet, it's like somebody that has a car.
Yeah, it's not
Or
very.
is taxi or
Yeah.
something.
And we are also doing this in all electric vehicles. So that's another piece of it. We're trying to help that transition to the electric vehicle, which I know the state is advancing towards. We've now got in our garage 2 of the 4 vehicles. We're going to have 2 Hyundai vehicles and 2 Teslas. The Tesla company has given us the fast charger. We are partnering at every level. We are working very hard to use philanthropic funds to really help us scale up. So we're working hard on that piece. We aren't intending to rely predominantly even on state and federal funds, but we are, to the degree, we are partnering with Green Mountain Transit to provide those. It's a new idea. It's a new idea because Einstein's theory of insanity is doing the same thing over and over again and expecting a different result. And we see the challenge of poverty as growing, and we're trying to think of new ways to help people be successful. If they can't get to the job consistently, they certainly can't succeed. So that's our goal. We're really just starting with baby steps. We're calling it a phase 1. We're really thankful to the Agency of Transportation for helping support this effort by giving us a try. Most importantly, Green Mountain Transit for bringing us on as a subrecipient agreement. We're going to start providing those essential rides, and we're going to go from there. And that was really, we wanted to make sure you were aware of this and sort of tuning into it. The program Mobility for All is really I think, funding opportunity for us to expand beyond just the elderly and disabled and Medicaid transportation to providing, on-demand rides for people. For example, we run Head Start. Head Start is early education for at-risk families. These are families, kids in foster care. Their parents are incarcerated. Their parents are in substance use recovery. Really challenging families. And we have 350 of these folks we serve just in our region. One of the programs is home visiting. So the kids can't get to us because they don't have transportation. So we have home visitors that go to these homes every single week. And when I meet with the home visitors, I ask them what are their challenges. And I thought they were going to tell me they aren't getting paid enough. They're upset because of something that Capstone isn't doing right. Every one of them, they don't even know about this program. Every one of them says, our families need transportation. This young mom's baby is sick, can't get to the doctor. I mean, it is so profound. We also run a program for pregnant and parenting.
That's because there isn't a volunteer driver.
Yes, or they have to have signed up 48 hours in advance because of that. And we're trying to, we are gonna have to, that's the system in place right now with Green Mountain Transit.
So you want a more on demand.
Yes, we want this to become an on-demand sort of system that, you know, it's not just for our Head Start program. The organization serving these clients would be the people to get them onto a system. We're gonna be a membership kind of system. But so when our clients need a ride, if they don't have the capacity to get it for them, we can get it for them.
Are you looking at some point where Head Start would be more than to move away from home? I mean, remaining in that home setting can be very isolating, and maybe you can give a ride here or there, but my question is there, as you envision this, are you thinking that you would bring more of those Head Start students to a center where parents could come as well? I mean, I'm just wondering in terms of your example, whether you see this coming into, I think some Head Start programs might have transportation to a center.
You're absolutely right. Some do and some don't, but actually, and
So I'm just
yes.
wondering if you're, you know, are you looking to something that where this would develop so that you're not a parent who's at home all the time is very isolated, doesn't have network, oftentimes doesn't have support. There's a great deal, we're even hearing that as bad as some of the motels are, that there is still a sense of community and support that is derived. So I was just wondering whether you see the transportation, in fact, coming so that rather than that home visit, which is very time consuming because you got to travel, to whether you were seeing a different model of serving those Head Start families.
We do have center-based care as well, but absolutely. If there are families that are only on the home visiting program because they don't have transportation and want to get to the center, this would be exactly the kind of thing we would hope to eventually be able to serve. I'm going to give an example. We also have a pregnant and parenting teen program as part of our Head Start. So when young women carrying their babies to term drop out of high school without a hope of getting back there, we have a program where we have all of the, not only education to get them to their high school diploma, but we have parenting, we have the child care center. So this is a fantastically important program. We have students who can't come because they don't have the ability. It's an example to the point. You can't get to high school. Because you have a kid and you can't have
testimonies I heard was across the hall at the Russet Committee institutions. We talked to someone in the correctional facility of the Maine, provides all these jobs that people are looking for restaurants. They bring them to their job and they pick them up after work, and they've got half of the facility working, with a great career builder. And we remember that. That was the best one I heard.
And to add to that too, we asked this very successful program, what would they have done different when they put this facility in, and said we would have built it 2 miles closer to transportation.
Yeah, to the
2 miles closer, because it was 2 miles away from where the line of travel was, and that was a mistake.
So they're making money, they're learning a career in restaurants, and the restaurant industry is picking up most of them.
We have this workforce development where we train people, but they can't get to Waterbury for a job because of the transportation.
Yeah,
So
that's a
it
big
becomes this, and for the families at home, Senator Kitchell, the isolation and the challenges that they don't overcome because they literally can't even dream of it.
If there's anything that I wish we could make more progress, and because you mentioned pregnant women, Vermont unfortunately has the position of being one of the highest states of pregnant women smoking. We have not been able to bend that trend. The cost of tobacco is absolutely enormous. I don't know what it is, 10 or 14 bucks a
It just
pack.
got, back you said that, I got a notice yesterday because they're going up another 20 cents a pack. It's almost $14 for a pack.
So it's not just an economic issue. You think about the cost that is being spent on, even if you go to New Hampshire, which might be a little cheaper. But the other part is just the health implications for low weight birth babies and also secondhand smoke. So, you know, one of the things that I've just been so distressed about is how we have not been able to move that ranking, because we view ourselves as a healthy state. We view ourselves as having good healthcare coverage. We view ourselves as doing a lot of prevention. And to me, if there's a population that you would really want to target for smoking cessation, it would be pregnant women for all the health reasons, but also if you're not working or you're dependent on reach up, the cost of the cigarettes out of a $850 a month benefit is creating financial hardship in a variety of ways. I'm just raising it. I met with someone who was in prevention and was in healthcare, and they said they weren't even aware how poorly Vermont was doing. So I'm going to bring it to your attention. It just seems like it's an area that we have not made any progress, and it seems like our WIC clinics, our home visiting, our prenatal care is something that we should be doing better, and we are not.
I want to just share that our Head Start, I would invite the committee to join, to visit. It is, Head Start isn't just a childcare center. It is a whole family health and education where we make sure that every student and their parents gets a primary care provider, and we have to prove to the federal government that they're seeing their doctor. We have cessation education. We have mental health care, which I think is one of the most important things, for which I raise philanthropic dollars, because if these families can help break down the barriers and stigma to mental health care. So everything goes to the kiddos and their parents. And this teen parent ed program, I'd love for you to meet. Senator Perchley came and met with the students, and I think maybe they're going to come to the State House. We have to get that going, right?
But I'm saying, in spite of all that, we're not making as much progress.
Yeah,
as
it's a drop in the bucket, and I also was not aware of that. The thing we are also really focusing on is suicide prevention right now, which is a totally separate, but also our data are really not in a good place there.
No,
So
that's really been funding 988 and
Yeah.
Getting 24-hour coverage on that. So yeah, and the other thing is the data show that northern states, I don't know what it is, if it's geography, have a higher suicide rate than other states. So it's some of it is regional.
Light deprivation.
I don't know, it could very well
yeah,
be.
light deprivation and
But if you look at that, and the other thing that we also have is a very high rate of young adults who are on SSI compared to other states, which have taken them out of the workforce. So if we're looking at where we have, potential and human capital, if you're now some, because of health, obviously can't, but there are other people that need to think about how we get them into the workforce.
And one of the great programs is Community Kitchen Academy. We spent 13 weeks, and they're coming every day. They have to show up, and every day they're learning about this. They're learning about teamwork. They're learning about being successful. They get an internship. 96% of them end up in a job afterward. But it's people like you're referring to. We hired to run our food shelf a gentleman who was in prison for 23 years. Until this program, he had never been substance free. He has been substance free. And he tells me how many days every time I go and see him. And it's because, to your point, he's been given the confidence that he can succeed. He's given the support from our program, and he believes in himself. And it's such a mix of problems. Anyway, so back to the transportation. This is, I don't think I mentioned, this is going to become an app-based, so you get on your phone and you can get that ride, just like the Uber and the Lyfts of the world. But we're starting with Green Mountain Transit, with their paradigm, and we're building from there. We're gonna scale up when we get more funds from philanthropic sources to get more cars, more drivers, and therefore more markets that we can reach to pay for our full built-out
You've
system.
got a lot of moving pieces. in this.
I do.
I mean,
You think I sleep? Not at all.
I mean, you gotta meet with the people, talk to their issues, and then you gotta find care or services for them, then you gotta provide transportation. It's gonna be a challenging thing. One person could take days to figure out what you're gonna do.
Well, everybody has different needs. That's why we want to enhance the system we
Yeah, it's
have.
not, everybody doesn't have the same needs, that's right.
So one of the reasons we wanted to come in, I wanted to invite, I did convince my friend Chris Cole to join this wonderful effort. He's now the first part-time, very part-time, executive director of Community Rides Vermont. And he has some thoughts about what we might want to add to the bill that came over from the House. Is that right?
Yes.
For this purpose?
Transportation bill.
The transportation bill. That's what brought us here.
Well, Chris is good at this, so now. Oh, good morning.
Good morning. For the record, Chris Cole, Executive Director for Community Rides Vermont, AKA Gopher.
Why do we want to put all this in students?
Well, because remember, we're putting the incentives in the statute.
So the House Transportation Bill came over, putting the incentives that were established in 2022 in the Transportation Bill into codification into Green Book statutes. And the individual, they did two things. One was that we're interested in. One is the individual incentive, which was capitalized in 2022 at $12 million with two incentives at different economic thresholds depending upon how much an individual makes. You could get a $3,000 incentive, and then if you were even poorer than the first group, you could get a $600,000 or a $6,000 incentive. There was also a section that the House brought over that was a fleet incentive program. And that program was capitalized at $500,000, and you could only get a $250,000 incentive. As Sue just explained, we are a unique creature in trying to occupy a space in Vermont that is a public-private organization. Public in the sense that we contract with public transportation, provide trips, as Sue indicated, for the elderly and disabled to Medicaid at a lower rate than what GMT can provide them for. So it makes economic sense for them to contract with us. And then we want to provide market-based rates, similar to like a reliable cab company. There is a market for that in central Vermont. We can make money doing that, and we want to take the profits from that side of the business, as well as philanthropic donations, to support our equity side of the business, which is what the government relationship is. We buy our cars ourselves with philanthropic dollars. We don't use government money, and then we finance them, but we use those cars in government service as well as private service. And the reason why we're electing to purchase our own capital is it gives us more flexibility with our program to use the cars where we want. 1 minute it'll be driving on behalf of the government, on the other minute it'll be driving on behalf of a market-based ride. So we need that flexibility. We are seeking to provide incentives to those individuals that can't afford cars. And as Sue mentioned, it's about 30% of the population surveyed in our region. We believe that when the legislature is creating incentives programs and trying to get different groups to purchase electric vehicles, that some acknowledgement should be made to not-for-profit shared mobility providers. There's two in the state other than public transportations. us, and we haven't started service yet, Community Rides Vermont, and then there's CarShare Vermont, which has their own equity program. They offer memberships to their system for people who meet one of the criteria in the language, whether they're Foursquare or Three Square, or I used to play a lot of Foursquare golf when I was in elementary school. Three Square or some of the other programs listed there. And the reason why we have shared mobility providers is that there are certain populations in the state that will never own a car. They either can't drive, can't get a driver's license, or they're too poor. And we think that these folks should also be part of the climate change transition, and that we're able to provide car rides for them in electric vehicles. Because absent our service, this population can't take advantage of those incentives. And it's great that you have a policy to meet the carbon goals that the state has set for ourselves, but we believe that all populations of the state should be brought along in this exercise.
If you, excuse me,
Yeah.
if you get someone some services and you provide them with transition to job, don't they have to be off of substance use? I mean, if they're on drugs or something, you have to.
You talking about our passenger or our driver?
Yeah, the passengers. And to help them out, you want to help them, but do they have to go through a process of getting clean? Because otherwise you're just wasting your money.
So there's a program that the federal government provides funding for to transit agencies called Recovery and Job Access. And it is exactly for people who are in recovery. And once they come out of recovery and they're still have a clean bill of health, they get funding, but it's only for 2 weeks to provide them with access to their new
Because if they're gonna
jobs.
stay on drugs, if you're wasting your effort, right?
Well, but we also believe that level of service needs to be enhanced more than 2 weeks. So the federal government's only providing 2 weeks. So we came to the Agency of Transportation with a proposal called Mobility for All, which is not Medicaid, not job access recovery, not E&D, but for general population that live in the rural areas that transit doesn't serve, or have jobs at night when transit doesn't operate. Transit shuts down at 6 o'clock in this region. And we have many people who work service sector jobs, grocery stores till 11 o'clock at night. Hospital. So we want to serve those populations that are currently not being served. And we're doing surveys within our community to understand what their needs are in terms of mobility. So as Sue said, phase one of our approach is just to stand up this subrecipient model and work on behalf of GMTA and help them out and serve their needs. Then we're going to work to build out our employment phase using the Mobility for All money and make relationships with businesses, get their money into the system and whatever we can get from them, and build out a program taking people to work. Then later we will work with GMT and pilot this on-demand service. GMT is talking to us about being their micro transit service provider in Barrie. They have a grant from VTrans, and they are thinking it might be beneficial for them to connect with us. Now think about a micro transit, a bus working in a 9-mile, which is what the Montpelier My Ride is, in Barrie. They have a 9-mile circumference, and they can get people within 30 minutes of making a request on the micro transit, which is great. Some of those trips can go to the hospital under Medicaid. Some of those trips can take E&D people, as they do now in Montpelier. And then think about electric vehicles in an outer ring connecting that entire service to the rural area, so that sometimes the trip from the rural area is only be to connect that person to the microtransit bus to get to the hospital because it's already going there. And so the algorithm that we will both use will direct the fleet of cars and the buses to work in concert together to cover a larger area.
There's some companies that give you money to provide the help. I mean, like hospitals or businesses would give you some money.
We have spent the last 2 years making relationships and laying the groundwork for that. Their message to us is, when you're ready to stand up your service and you have hard costs for us and you're ready to give us the ask, come back and talk to us. So we've already had the meetings. We're in the process now of the last 30 to 35, 40 days to stand up the company to begin operating those services just for GMT, phase one. We want to become a good transportation provider, and that means meeting GMT's high standard and qualities of service with our vehicles. And because we have a subrecipient agreement, that's different than contracting out for service. It means we're going to be a trusted provider, and we're going to have a contract every year from
I know
GMT as
some
long as
companies
it's
pay for
service requirements.
transportation to get to people where hospitals, IBM used to, they had a program. Yeah.
UVM does, the other colleges and the medical institution in Burlington pay to get their employees to work, and they usually shuttle them in from free parking lots.
Right.
We don't have the level
Well,
of
you can't go to their home.
density or employment opportunities that they have there. So we're going to be a little bit more strategic, and you know, when we develop our first ride to Darn Tough from Barrie to Waterbury, we're going to fill up that car. So now we're going to have 4 people. We have different mobility.
We have 7 passenger vehicles.
Yes.
You gotta be pretty small to fit in. I can't. I'm not sure
But we're definitely looking at all ranges of electric vehicles and all mobility service options. We could even have a car share commuting option. We plan on having car share. As a mobility company, we want to offer an extension of car sharing that's still run by the Burlington Car Share Company, but we will do the operations in our area. So we have a lot of plans. There's a lot of phases in our business plan and on how we're going to and a large part of it, you know, is up to these folks in terms of the funding they raise from philanthropic sources as to how fast we can scale up the non-governmental side of our operation. But we've done a lot of work, a lot of market research. We've had a lot of consultants look at the need in our area, and we feel
You have to
fairly.
provide childcare, you have to bring them to childcare too, so the kids.
We operate childcare, so we're bringing them to,
Well, Ed starts child.
and so part of it in dealing with
0 to 5.
dealing with the community members was listening to a single mother of 3 kids who had a master's degree and lived in Thetford, I think, and she was unable to work because she couldn't get a ride. She is our
That's a service.
classic person, and she educated a lot. She said, you need to get cars big enough where I can fit my 3 car seats in them. And so we are definitely engaging with the community to understand what their needs are so we can tailor the service to meet those needs. But she was a great example of somebody who's looking for employment and doesn't have a ride, but has that childcare need you were pointing to that we need to accommodate.
Russ?
Can we totally understand the need and what you're doing and the great things that you're doing and all that, but can we go back to the ask of what you're asking us to support and why it needs to happen and what happens if it doesn't? Can we talk
Sure.
about that a little bit, please?
Are you referring to this?
Yes.
language?
Yeah.
I'm having,
So
Yeah,
there
I have a
are,
hard time going down through it. I don't have enough context here
right,
to
I'm gonna give you,
see what happens if we don't do it, what if we do, just to focus on this for a little bit
sure,
of what you're asking us.
why is this language necessary? Do we?
We purchase-
GMT, because you're purchasing cars? That's what you,
we purchase cars.
so you want
house.
to be, you want to be eligible for the vehicle incentive program?
There are 2 vehicle incentive programs. One of them we're eligible for, which is the fleet
Fleet one.
program.
Uh-huh.
It's only capitalized at 500,000
Right,
and the maximum award is 25. We serve 500,000 is what's capitalized.
2,500 per car.
Yes, I'm sorry. Yeah. The individual award is capitalized at 12 million. And the maximum incentive you can get is 600,000.
right.
We,
6,000.
6,000, jeez, trouble with my numbers this morning. We serve a population that is poorer than the populations identified in that section of the bill. And so just because we're not an individual, we serve individuals who will never be able to apply
So it's
to
to give
get.
you access to the 6,000.
Yes, ma'am.
And it says you shall be eligible. Does that mean you're asked to be carved out so that you get 20 incentives? And I don't even know
No,
what.
just that we're eligible. We have to compete with everybody else.
It's just you're eligible,
Yes,
but you, to compete. But there's a limit here, no more than 20 incentives over the existence of the program. And I don't even know if we have a time frame for the
So
program.
that language,
incentives.
that language is in the fleet section, and I thought it appropriate to bring it over to the individual section as well, to place a cap on the number of vehicles that a not-for-profit mobility provider.
I don't know how you would, over the existence of the program, that's what I'm just thinking. What if the
So-
program went over
Well, they
10 years and you used your incentive in the first 3? That means you don't get any,
They'll be back.
they'll be back.
Mm,
Well, I mean, the part of it is
You have to-
putting a limit on the existence when we don't have any idea about the time frame.
So that's the language.
I know, unless I'm looking at it, it was like, well, I don't know how you,
That's the language, that's the language in your bill. So, and you're putting it in, the House putting it in green books. So when the 12 million runs out, you either have to recapitalize the program or you delete it from the green books.
but then it would continue to exist and you're capped at no more than 20 incentives. So we'd have to,
And aren't we seeing that some of these incentives are starting to be decreased? You know, in a lot of these big programs and stuff, and now we're going up higher. Just,
well, this is.
I'm not commenting on the substance of the House bill and what they're passing over. What we're saying is, while you're considering this, if you do support in some fashion the language that the House is putting over, please consider that the poorest of the poor cannot take advantage of that program and that we serve them.
Well, the House is sending over, we have the T-bill already.
Yes, it's in there,
Well,
section 12 of the
Yes.
T-bill.
okay, so that they have said, I thought you were talking about there's another bill or something.
No, this is in the T-bill. I apologize. That was confusing, but what we're asking is, and we don't know your position on the incentives, but if you're going to consider them, please consider broadening the eligibility to shared mobility providers that have programs.
And the House did this.
Section, is that?
It's section 12 of your transportation.
They
bill.
created with the T's incentives just for fleets. So we already had this, the individual incentive,
Right.
that's $6,000. They created a special fleet incentive,
I know that, yeah.
which they would be eligible for, but it's only 2,500. Giving their service model, they want to get the 6,000.
But my question is, this language that would give you access to the 6,000,
Correct.
you're saying the House has in their T-bill?
No, they do not have this
Oh,
language,
that's what
which is why I'm here.
Okay, that's all I'm asking.
Yes,
Is
it's not in the
when
bill.
I thought you were saying they had sent this language over to us and you wanted us to agree with it. What you're saying is they didn't include it. Okay, thank you.
They haven't seen it.
Parts of this are taken.
You got to replace your ride in the bill, and mileage smart.
Yep.
Okay.
So I understand now.
Oh, that's
what-
something else. Okay.
I thought you were referencing something that the House had put in specifically to address this. But, okay.
So what language are you looking for?
Well, I really would like this language that basically says that because of the nature of their work and using vehicles to serve the low-income population, that they would like access to the $6,000 per individual max.
And-
I guess instead of individual, it'd be 6,000 per vehicle.
And because we have to put a down payment and then finance our vehicles, unlike transit, which keeps capital and operating costs separate, we have to include those costs, and therefore we provide less rides. If we were to get the subsidy, we could provide on average 100 more rides because the subsidy would
How much
reduce our
is that
operating
going to
rate.
cost DOT, or how much is it going to cost?
Well, it's within the appropriation. It's just allowing.
We're just-
How much is the appropriation?
12 million, we're just from 2022
you're
broadening eligibility.
you're looking to almost spend, well, I mean, really 3 times the money when it's all said and done, but you're not asking for an appropriation above 12 million. You're just looking to spend the money faster on, by a third less, by selling a third less vehicles.
We're looking to put more electric vehicles on the road serving populations that we serve rather than fossil fuel.
They're asking to be eligible for the $6,000
Right now, they.
subsidy. Right now, they're not. So
Right,
that's,
at 25.
Well, they're at 2,500.
but it
And
doesn't
another
include
35.
the 12.
And why do we come up with the 6,000? Why is it the 6,000 number? Is there a significant number that is what it is? I mean, that's why isn't it 4,000? Why isn't it 5,000? Why are we at 6,000? Just
That's a
another
previous decision from the legislature.
That's, yeah.
Michelle, you had a chance to digest any of this?
Yes, actually I have. I spent some time chatting with Chris about this a couple days ago, and then yesterday when Patrick Murphy was in, he and I spoke to Senator Perchlake further about the concept. And I think it's a really good framework for us in terms of expanding our mobility options for lower income Vermonters in need.
Because it'll serve more than one
Yeah,
person,
one
for
person, yeah.
example.
While also meeting our climate goals. And there's a few factors that haven't been talked about today that I just want to emphasize. The Inflation Reduction Act, which was the federal bill that will allow us those big up to $7,500 tax credits when now or when we get to January. There's a mix of different configurations on that. Also has a fleet component that is a fairly low bar in terms of the types of mobility services that both Community Rides Vermont and CarShare Vermont provide. So both those organizations, we believe, will be eligible for that federal tax credit, the amount of which, I can't remember if it's 7,500 or if it's a little higher for fleets. So when we take that tax credit, which basically as of January, the car dealership will be taking advantage of the tax credit. So it's not as though the nonprofit needs to have a tax liability to take advantage of this. And then if we were to go Senator Engel's question, up to $6,000 for lower income Vermonters on a EV incentive. We have been it's 4,000 right now. And in working with the House and working for the Center for Sustainable Energy, who administers our EV incentive programs, they are constantly analyzing at what point will a consumer buy an electric vehicle regardless of whether they have an incentive, or if they would not make the purchase but for the incentive. And in particular in lower income households where we're trying to get more folks into these cars that cost the household less money for their transportation costs. So we wanted a little flexibility between currently 4,000 and up to 6,000 because of the market variability of car prices and where that incentive works best. So that's where the 6,000 is coming from. So under this proposal, what I would suggest is that we work with Chris and folks on the language to create a carve out in the fleet program that we've presented this year, which would allow for up to a certain number of vehicles on a first come first serve basis for nonprofit mobility transportation service providers in the state to receive this incentive. And they could, and the caveat being they would need to take this incentive and put it on top of the federal incentive. So you could get, $13,000 off a car. And if we cap the amount of the vehicle price to something whereby we are, like CarShare Vermont typically purchases vehicles that are in the $30,000 range, whatever. We're not talking about capping Teslas, but say we have these $30,000 vehicles, you take and cut the price in half. That really advances the opportunity for these shared mobility companies to begin to be able to afford to deliver these services in the model, the fiscal model they're talking about. And by capping the amount and revisiting it annually, we can begin to, we'll be collecting the performance information about how many low-income households were we able to serve with these vehicles that we have put in the system, and look at the performance and see if the program is working for us. So that's the overview.
So generally, is very supportive of the direction that this is going, and one reason why, and I'd love to just validate your expectations of what these electric fleet-owned vehicles to this program would entail is when it comes to electrifying fleet vehicles or shared use vehicles. There was a presentation I have to find my source, but it showed that fleet vehicles usually put on 2 to 3, sometimes more, as many miles each year. And if we want to impact our climate goals, electrifying the vehicles that are on our roadways each year 2 or 3 or 5 times as much as having 2 to 3 to 5 times as much impact. Would you agree that these fleet-owned EVs are likely to be used and actually on our roads more as much as other fleet-owned vehicles for organizations?
I would say more, because our service model is use the vehicles like crazy in the first year. High mileage. We want these vehicles operating 9 hours a day if possible. And then we're going to sell it at the end of the year. Something that hasn't been talked about in the incentives, and I don't know the legality of it, because as you know, I'm not an attorney, but we've been discussing it. These incentives are Vermont funds that are being invested in our climate change goals. And yet, when somebody sells an electric vehicle in the state after receiving an incentive, you know, it can go anywhere. It can go to Connecticut, go to Massachusetts, doesn't need to stay in our state. We intend to sell our vehicles in the state. That any incentives that we get from the state of Vermont, because we feel that you know, part of our policy goal is mobility. The other big part of it is climate change, and we really want to populate our community with these electric vehicles, and we want to be the go-to source for used electric vehicles as we turn them over each year.
We did get some testimony, though, that in fact, used car dealers are going to auctions and bringing EVs back into the state
Because of the demand.
because
Yes.
of the
Maybe it's
demand.
because of mileage.
Well, that's true. I mean, that's where we heard the testimony.
And then just reading too, that, you know, the 12 million isn't for used vehicles, but that the cost of electric vehicles used are starting to drop because they're starting to get a significant, well, there's just supply and demand. There's starting to be more of them become available.
But we're proposing access to the vehicle incentive, the 6,000. What we've just heard
Is the fleet.
would be, this would fit more under that fleet proposal. And that fleet proposal has a maximum award of 2,500.
Yeah, we would put a new section in that fleet language specific to nonprofit
That would
transportation
allow a
mobility.
higher award.
Yeah, that allows a higher award. And, you know, honestly, I don't think we need to change the capitalization from 500,000 if, depending on how many of these awards we're putting in this year. The fleet piece is all very experimental at this point. And so, you know, if it's wildly successful, we could come back to budget adjustment and suggest, well, maybe we should move some money from an underperforming incentive program into this, or, you know, take a look at it next session.
And how long have we been doing the 12 million? I mean, this is the first year or
2022.
2022,
Yeah.
and how has the performance been on the 12 million? Are we
Great.
burning through it?
We're burning through it, and so right now we have 9 million something in the new EV incentive program remaining. So
And the 500 is new money.
no, the 500 is being taken out of the Replace Your Ride program.
Okay.
Yeah.
So it's also 2022 money.
So I mean, I'm supportive of it. I really, really am. But I'm also worried about the people who will get shut out, because we don't know if we have enough money coming forward, as we are hearing the economists talk about, if you guys come back. And so what happens to the people that get shut out of the program because there's no more money available to them? What happens to those folks? And I just want to make sure that we're not over incentivizing some purchases and shutting people out of the marketplace.
Yeah, I mean, I guess centering else, what I'd say to that is this target population that we're trying to address with this incentive idea is already shut out of the marketplace because of the sheer inability to even purchase a vehicle. So I think, you know, right now we're incentivizing households that make up to $150,000 per year for couples, and they are also eligible for the federal incentive that we, you know, are having. And so I think that the minor amount that we are going to be using to experiment over the coming year with this model and reevaluate it as we go forward is a kind of a drop in the bucket compared to other opportunities that are out there.
This is a pilot program. And
I just want to really say, I love the other point that you made, which is by EVs in our fleets, we're going to put a ton of miles on them in the first year or two because that's when they're most reliable. Then we're going to introduce them as used EVs in the market, which accelerates to where we want to get to. So I'm going to add that to my talking points on the campaign trail.
Well, I like the point you made about the amount that a fleet, how much more we're taking off the road.
Well,
And not
of course,
part of that.
we're, and the fleet, we're thinking of the delivery trucks and so forth that are out there doing it. Obviously, this is a very different population being served than the commercial fleet traffic that I think I was thinking of with that 500,000. On the other, so these are people that right now are not using much because they don't have any capacity to do so. The one thing that is particularly interesting is that we're dealing with severe workforce shortages.
Right.
And if there are ways, and obviously childcare has been identified as one of the key areas to support people in work and employment, but the other part is getting them to work. If in fact we can make progress to get more people, because we know that certainly employers are having to reduce hours or whatever, or having trouble, particularly in, I would say, grocery stores that stay open till 9 or 10 at night, or in the food arena. That if there's, we can demonstrate that in fact, at the end, these projects, and I guess I'm like thinking some of these employers, if you've got 5 people, we've got programs in place already to help with van pools or ride share or whatever. So my concern is that we're doing something that complements, or I don't know, I don't want to overlay something on top of something that we already have in place. And that would be my concern, that this is complementary and additive and not out competing with something else, or AOT says, well, we'll discontinue it and allow it to be done through a different delivery model. And the same is true when you're looking at the philanthropic community, because a lot of the public transit entities are sort of out there asking for financial community support, and there's only so many pockets that we've got here.
So we were.
Roberta has a question.
Yeah, I support this, giving the nonprofit fleet organizations a higher incentive than 2,500. I sent this language to Anthea. She had some questions just about how it was drafted.
Yeah.
Patrick also has it. He said he was gonna provide some maybe different language, because maybe we just change the wording in the fleet section.
Yeah.
To say, like,
It's getting really confusing, I thought.
yeah.
I think this, and I want to support it too. And the reason why I raised the questions is because I've seen these programs before, just not in this. It was in housing, where we were using money from housing, some community building grants to help first-time home buyers buy housing. And then they were able to couple that money with other programs. And what ended up happening was exactly kind of what I'm raising the point here is that they just didn't need that much money. They didn't need that much money, and they were taking monies away from other folks that could have used the money. The money, there was a burn rate on it, and then other people were shut out of it. And I take your point well, Michelle, that we're probably, if the incentive isn't high enough to help anybody, I think that's kind of what you said, and that this would open it up more. I just want to make sure that that we watch this program well enough to that we're just not throwing monies out there and it's great, and I just want to help as many people. That's what I want.
Can we have a review date on it, like 3 years?
I'd like that.
Or something?
Well, it's a pilot, it's in the pilot. If we move it from here into the fleet, it puts it into that arena.
I don't even know if this is possible, but would you be at all opposed to any type of language to consider that any nonprofit that gets incentivized for this would be expected to, can you do this? So not sell it to auction to other states, but have some sort of Vermont market for the reintroduction of the used vehicle at the end of its life cycle?
We don't know the legality of that.
I did bring that up to Patrick McCarthy yesterday. His suggestion was, well, maybe the most we could do is some kind of attestation where you say, if you're gonna get the incentive, we're saying you need to sell it in the state, but you're to try to police that and enforce it, but maybe that's enough to.
And being in that business for 20 years, I also know that if you're losing thousands of dollars by selling it locally,
Yeah.
we're only gonna end up paying that later on when they come back and ask for more money.
They should bring a good return after 1 year. I mean, I would think there's.
Well, 'cause
up there.
The motor, the engine of a electric vehicle is not like a fossil fuel, so you're still gonna have a really high value in that vehicle when you sell it, even though it has high miles.
Years on a battery. alone.
Right, and they're finding that the batteries are actually lasting longer.
Yeah, that's right.
And-
Your business model, in fact, is to,
Yes.
and your mission is to keep those cars here in Vermont.
So I think the framework that Michelle outlined is workable for us. And love to work with you on the language as we bring it.
The language is
back to the
hard to
committee.
read, I have to say.
I've been out of practice, Senator.
Well,
Representative Wall.
no, I understand what you were doing, but it was like,
Yes, it's hard, it's always hard to read amendments.
Well, the sooner you get the language agreed upon and get it to us, and we can talk to the House, and they can talk to the House at that time and try to get this. We don't have a lot more just to go, so we'd like to
Yeah.
get moving.
Yeah, that's why I sent it to Anthea so she could look at it, so if we could get at the end,
and
Patrick's
the,
like.
and the advantage when you're sharing a vehicle, instead of one household having you're serving maybe 5, 6, I don't know how many
If,
different.
if you look at it in terms of miles, right? Our vehicle just doesn't sit for 8 hours. You know, we're going to use it all day long. We'll have a supercharger to get us that 20-minute charge when we need it, when we're very busy. We won't be very busy in the beginning because we'll be serving phase 1.
So how come you're doing Teslas? Did they give you a special deal?
They gave us charging stuff
They have a low.
for free, but really
Well,
what,
GMP gives you something for free too.
so in transportation, the highest value is always safety. And we want all-wheel drive vehicles so we can drive all year round, especially on rural roads.
And 7 passenger.
And we also need additional storage space for the aforementioned car
That's
seats.
what it's in 7 passengers.
Yes,
one that-
they are the one that has the
The
4
Model Y you can get to, but they are very tiny seats in the way back.
But they also store car seats. We really
Good for
need,
car seats.
we need car seat storage. And we wanted all-wheel drive vehicles, and we also wanted vehicles that had a good resale value in Vermont. And if you want to sell a car in Vermont, I'm pretty sure you should have all-wheel drive or four-wheel drive. So we've, I think, done a very good job looking at the
I don't
market.
even have that.
Yeah, but they didn't make them.
Senator?
We need it though.
They didn't make it back in 62.
Senator, you're cut from different cloth than most Vermonters. You still have the vestiges of growing up on a farm.
They didn't even have automatic transmissions with J-Bob.
We still have a manual shift
No, we
front wheel
don't.
drive. I think I'm really ahead of
We were looking at the option of a hand crank on the front of the
the. I
Tesla.
got one of those.
We,
But we opted not to.
I have a
Four of us
hand
in the committee want to co-sign for it. That's a bad one. And I know
In a year, we're gonna have.
I'm an
some turnover
embarrassment
points
to
for
the
that.
parking lot.
when she buys her son a brand new car.
Senator Moss has been giving his bottles to her.
My son is doing much better than I am.
Both of those cars we're
Yeah, you
purchasing
get
are
your credit card, why
also
not?
hot in the market, and just those virtue of those cars themselves will have great resale value. in Vermont.
You know, I agree. I just want you to know that.
We used to get two Teslas and the 2 Ioniqs. Is that?
Monday.
Yeah, two Ioniqs, and then two,
Is that a Tesla?
it's a Hyundai.
Oh, Hyundai. Oh,
It's the lowest end that needs those, so we have, and we're testing new things, we're gonna test our business model of how much the resale, because don't forget, that keeps us in.
In business.
As I was saying before, you know, in the spirit of the pilot, we are a pilot. You know, we are learning a new business model for serving the public and private sectors and then commingling the funds to make an organization function in this ecosystem of Vermont.
Well, for the record, Corvette is coming out, electric cars.
As soon as they come out with the 7-seat version, Senator,
Yeah,
we'll put that in our list.
They're gonna come out with a station wagon, that's Corvette, a station wagon.
Corvette station
They're
wagon?
gonna have a it's ugly as hell. Excuse me, but I mean, it doesn't fit the Corvette class, some of the station wagon.
It's like a Porsche Cayenne
Yeah,
I want to see that. I'm gonna Google it.
I don't know.
Yes,
Thank
anything else?
Thank you
So
for
you're
your,
gonna get this all together as soon as possible.
we're gonna work with Michelle on
Yes.
language and get it to you ASAP.
Thanks, Chris, you know what you're doing, I'm surprised, you're doing good.
I've had some rest and recuperation from my last tour of duty here in the state
Yeah, yeah, I
government.
know.
And
I missed picking on you, wasn't any fun?
ready to dig in. Well, you know,
So
I
when is the
had,
train coming to Montreal, Chris?
Yeah, I remember
I got you a train to
Yeah.
Burlington. I
Yeah.
didn't even go to this special event.
You've been telling us to train in Montreal in 3 years, that was 9 years ago.
It looks like a hearse.
Yeah, then other
Oh, it
looking,
does, that is ugly.
That is really ugly.
Senator,
who the hell is
The only
that?
thing that looks like is the tail.
it
of
does
the-
look like a hearse.
Oh, my
Yeah.
The
God.
lights.
I wouldn't want that in my.
You can get to the funeral home really fast.
But if it was-
No, you know what?
Yeah, really fast.
The fire was hot.
Thank you, Senator.
Anything else? Anything else?
Thank you very much for your time. It was a great conversation.
That was
Can I have 1
ugly.
minute?
Yes,
Oh,
very
it's
good.
We'll get some
ugly.
minutes.
I just, so Paul Zabriskie, I'm the Director of Weatherization and Climate Impact at Capstone. And I just want to sort of reflect back what I've heard this morning, because I gravitate towards the social services, but I'm looking for sort of win-win-win. Sometimes social services can be 2 steps up and 1 step back. And weatherization is one of those win-win-wins where we win for the climate, we win for the finances in a household, we win for the commerce on Main Street, and we win for public health. And what excites me about Community Rise Vermont and the Gopher program is it's one of those win-win-wins in social service where we spoke about suicide rates and the impact of rural isolation. And so the opportunity to sort of break down those barriers at the same time, we're decarbonizing the state's existing purchase of rides through the E&D and MET programs, and improving on public health, getting people to the services they need to sort of improve the overall health of the community. I just find it incredibly exciting. I really appreciate that you all so thoughtfully engage in this new program, and we look forward to being able to cheer about it in the future.
Paul just clearly articulated in less than a minute the reasons why I want to work.
It's
in
pretty,
this program.
pretty hard to say no to this young lady.
Well, I think
Including myself, Senator.
Yeah, that's right, you know that,
I
yeah.
had to go get that guy.
the interesting thing will be after a year of operation, just to see what the impact has been. I mean, we're talking about it conceptually at this point.
The really interesting thing for me is going to be when we start the market-based service and understanding what the true market is and how much revenue we can take over to the not-for-profit side. Because the company we offer,
Well, you do that with weatherization now.
Yes. and and he knows that model, which is why he's affiliated in helping us stand up this company, is because we want to create those 4 wins, across the board. And really, thank you to the agency for having the open mind to fund this pilot. GMT's not here, but you're the former chair, so I'll let you take their kudos. We couldn't ask for a better partner than GMT and their new general manager. I don't know if you've met him, but he's absolutely, he's tops. He's great.
Yeah, like I said, I had a lot of doubts, but he came in a couple times with, and it really, I learned a lot about, they don't want to go non-fair forever, but there's a time zone, especially with the complications of credit cards. Then you gotta separate the folks that get free service anyways. So I learned a lot with his testimony.
Yeah.
And he wants to go back into fair. I don't want it free forever. That's my personal opinion.
I had a nice introductory coffee with him, and I went through my laundry list of issues that I had with the transit agency, and he had already identified everyone.
Well, you used to work in Veterans Affairs.
Yes.
The state government,
Yeah.
so.
He knows how to partner. And
Oh,
that's
he
the
had that
critical
he had that
position.
cowboy hat, I didn't know he was still.
There you go.
Looks like it's still hanging here, but I think that's not it.
It looks like Ann Cummings.
I know,
It's
so
been here for a long time.
everybody in finance gets one.
That's my hat.
Oh.
There was a Fedora Fridays thing for a while. So I just like
It was what?
There was a Fedora Fridays. So.
That's yours?
Yes, mine.
You gotta see his.
I wanna see it on
Oh,
it.
yeah, yeah. I got a brown one too. I always dress up as Indiana Jones whenever I get a chance to as well.
That's why my son's cat is named Henry,
Ah.
because Indiana Jones is an archaeologist and his real name is Henry.
Russ, what are you gonna give us? Give me
Did you know that?
What's that?
I didn't either.
Oh, Indiana Jones.
Oh, what would you like?
Thank you so much.
Thank you so much.
All right.
Appreciate the time.
Thank you.
Thank you.
Okay, we're gonna take a 5-minute break, or 10-minute break, then
Get that hat out of here.